welcome Bill Shorten and Julie Collins to our 2017 Mental Health Parliamentary Advocacy Day. In recent weeks, Mental Health Australia was involved in co-chairing a stream at the Labor Health Summit, where mental health was given a really good hearing. And today, delegations will meet with more than 20 Labor senators and MPs to further advocate for the sector. I had the great privilege last Friday of spending Friday morning with Mr Shorten and other shadow ministers to talk about vet and skills and jobs and education. It was a great day, and it's great to see an opposition focusing on building really credible policy so that they can become a more effective government. I think Bill has always been very committed to this issue and to social justice, and I know from working with Julie on the whole complex issue of diversity and women in leadership that she is also a person of great capacity to listen, to take advice, and I think you'll find what they've got to say this morning really interesting, and they've both very generously agreed to take questions after they speak. So I want to thank you for making the time, both of you, for being here today, particularly you, Mr Shorten, because I know what an incredibly busy schedule you've got, and for your commitment to health and your commitment to mental health. So on behalf of everyone here, can I ask you to join me in welcoming Bill Shorten.
Good morning, everybody, and thank you for organising this event, and then also, Frank, thank you for inviting Julie and I. You're the experts, so I'm smart enough not to give you a lecture, but good on you. But I will just make a couple of brief points, and then Julie and I would be happy to listen to you and take questions. I would rather, frankly, listen to you than talk at you. And I do that because Labor's a chance at the next election. I don't put it any stronger than that, but I certainly put it at least that. And so what we want to do is use this time between now and the next election, not only to oppose if the government's doing something wrong that we disagree with, but to prepare an alternative policy regime. And when I say alternative policy, that doesn't mean everything the government's doing is wrong, but I want to be able to present well in advance of the next election an economic and social program for the nation. One of those issues which would have to be part of that program, of course, is how we tackle mental health in this country. Having said that big picture, we're here to listen. We know that the Mental Health Commission report's important and we need to see action on it. I just want to give you perhaps a couple of personal observations. When I was at school, there was a young man who was a couple of years ahead of me. He was an outstanding champion. He was an all-rounder. He was good at everything. Used to wonder how these people were born, but anyway. He was a lovely fellow. And then one day at school assembly, they said to us that this person had had a cerebral hemorrhage. Well, he said he had died on the train. And we said, so what does that mean? And we were told during the course that he had a cerebral hemorrhage. No, he hadn't had a cerebral hemorrhage. I only found out years later that he'd taken his own life. Now, this was the best part of 30 years ago. It does show you, though, how we were taught to think about things and how now our thinking is evolving. Then move forward to some of my time as a union organiser. And there was an older man, so he wasn't a teenager dealing with mental health, he was an older man. He was a toolmaker at a factory in the eastern suburbs of Melbourne. And he had been unfairly dismissed by the company because he had a hot temper, and people said they couldn't work with him. The reality was, as we sat down and spoke to him, as I was preparing his case as an organiser, he had a hearing problem. He'd worked in loud workshops his whole life. But then what had happened is that he said, everyone's always talking about me. And what had happened is because he'd had his hearing problem initially, he had developed tension and anxiety, not in his teens, but in his adult life. And a lot of what was going on with him was the inability of workplaces to recognise the coincidence of a range of conditions at the same time, and then this bloke lost his job. Then I dive forward to being a parent, and being a parent isn't the only experience in life, but I tell you, it does give you certain experiences in life. And I think it's fashionable now to say young people, they have it different, they have it easier. I'm not sure they do, actually. You can't turn back the clock on the internet. You wouldn't want to, and social media. But you do realise how your kids and other parents' kids are vulnerable to bullying. They're trying to work out their own identity, and they've got these really powerful weapons called the internet, which they're sort of doing it in real time. I wonder how many of us in public life would be in public life if we'd had access to social media in our teens. Because the record stands, doesn't it? And whilst I don't want to get distracted about social media, my point about it is it's taught me that kids can need help. That it's not that they've just got to snap out of something. So anyway, the reason why I mentioned those three things is that it's then come to a further realisation. One of the things I do as opposition leader, and because I like it, is I hold town hall meetings. I do one a week somewhere in Australia, partly because if I just relied on a couple of the conservative newspapers to relay my views, well, it wouldn't happen. It doesn't happen. So I like to go out and talk to people directly. I want people to get to know me and my party directly, and I think people are a bit hungry for a bit of direct contact. But one thing, it doesn't matter where I am, in Townsville or in Hobart or in Bendigo or you name it, we've done plenty of these town hall meetings and there's hundreds of people. Mental health is a concern in the community. It might be a concern there it mightn't get the sort of day-to-day coverage in the media or the day-to-day coverage in the big debates, but it is a massive, massive concern. And I've never held a meeting where I don't get asked questions about it, especially in the area of subacute care and families. And indeed, people with mental health issues, but so we get them and we also get their families and the cracks in the system and the inability to get care and the stupidities. You can get funding to a certain number of visits, then it stops. And I get that, and successive governments, it's not a chip at the government alone, it's a chip at all governments. And I always ask this question at any town hall meeting I go to: how many people here have either had a direct experience within their immediate family or know a family who's had someone take their life? And it's always 60 to 70% of the hall put up their hand. It's massive. So I use those examples to say my party's interested in working on the issues. I do think we appreciate it. I could give you the economic stats, but you know them. For me, it's about community. We're interested in what works. I get that there needs to be continuity of funding. There's plenty of issues which drive people to their distraction in terms of the system. You've got to keep reseeking funding. There's insufficient resources. There's also just a lack of joined-up nature of services. But at the end of the day, what I want to say to you is you should be heartened. I believe, and I probably know, I'm not an expert in your field, but I have some knowledge of politics. I don't believe my party will do badly if we talk about mental health. I don't believe it's injurious to our development of a vision if we talk about it. We're not talking about a fringe issue, an add-on, a last paragraph in the budget papers, a sort of, you look down the list and there's a little line there, a little picture of a stethoscope or something, and, mental health. For us, it's fundamental. I've seen it in the workplace, I've seen it in families, I see it in communities. So we're interested to hear your views today and obviously the outcomes of today. So thank you very much for having that initial listen, and Jules and I are happy to take questions or statements. Feel free to say X, Y, Z. Do you agree? If you call me Bill, I know you're friendly. If you call me Mr. Shorten, you could be polite or not. But anyway, just feel free to call Bill. So happy to take questions or observations.
Thank you, Jennifer, and thank you, Bill. I think Bill's made it very clear that we want to listen and learn from you. We obviously had our health summit in this room just a few weeks ago, where we also had a roundtable on mental health and suicide prevention. We are taking this very seriously. I've also been out and about, and I'm travelling around the country trying to get to most states, but also talk to people with lived experience, people who are telling their story about their recovery from mental illness and mental ill health, but also those that are living with mental illness and episodic mental illness particularly, and living their lives. And as Bill said, we do know some of the gaps, we know some of the data, some of the service delivery gaps that are there, and we want to work with you on what the solutions for that might be. But this really is about people and communities. It's about making a difference. That's what we're all elected here to do. We have offered some bipartisanship to the government on suicide prevention, particularly because we realise that the statistics are alarming and we need to act, and we need to act now, because if we don't, those statistics are going to get worse. We know that mental health is around 20% of the total health burden, and we need to do more, and we're willing to work with you to try and do that. So today is really about listening to you, about where you think we should start and what we can do, and learning from you. So thank you very much.
Fantastic. Thank you.